Hello everybody, how are you today? Today I've got another great analogy for you. And what I want to talk about is emergency services versus services that are maintenance and prevention and place that you want to go for ongoing continued care. Now let's talk about this. Over here in this diagram you can see that we've got a great drawing. We've got a hospital, we've got an emergency room and a fire station. Now these are emergency type situations. Over here we've got a house, and these would be different types of practitioners. These would be your chiropractors, they're your naturopaths, your physical therapists, massage therapists, right? Two totally different areas, but sometimes we seem to confuse the two and maybe even overlap them. Now let's give a scenario. Let's say your house is on fire. Now who are you going to call? Hopefully you're going to call the fire department. Why? Because these guys have the right tools to put out the fire. And their tools are this. They're axes and fire hose and water and chemicals. And they're going to come in and kick your door down and hopefully do everything correctly and save your house, right? Now your house is drenched and it's in a bit of a shambles. When the fire department leaves and pulls out, who are you going to call the following day? Are you going to call the fire department? No way. Because the fire department, again, has tools that are good for putting out fires and not maintaining a house. Think of the folks over here as the handyman. Once the house has been saved and soaked, you're much better off calling the handyman. Why? Because his tools are paintbrushes and paint and hammer and nails. You see the difference, right? Now, emergency stuff. Man, I'm up in the woods and a bear jumps out and scares me and gives me a bear bite. I get a snake bite. I have a heart attack. I have a broken femur. You're going to go to these emergency guys. You're certainly going to not go to these guys because you'd have an outcome that's probably not so good. Now in America, what do? We treat almost everything as an emergency situation. And you can't continue going here for preventative maintenance types of things, right? Back pain, neck pain, muscle spasms, digestive disorders. Those aren't emergency situations. Those are where you're going to go over to these people, the nutritionists, the chiropractors, the physical therapists, the naturopaths, right? You see the difference. It's good to clarify that and know what situation you have to get to the right provider. I'm Dr. Craig, and that's something to think about.